Yeah, thank you so much to the chairs, to Jorn and Jeff for inviting me to speak to you today, and thanks also to the organising committee. I'm Harriet Rumgay. I'm a postdoctoral scientist at the International Agency for Research on Cancer, which is the cancer specialised agency of the World Health Organization. And at IARC, I work on studies on cancer prevention, so looking at the impact of modifiable risk factors on the global burden of cancer using population-level data. And this has led me to studying primary liver cancer, which is one of the most preventable cancer types globally due to its many modifiable risk factors that we can eliminate. And so I'm coming to this meeting today with the perspective on cancer prevention, which I'll bring to this presentation. If I can get to the next slide. Okay, great. So yeah, I have no conflicts of interest and my views don't necessarily represent those of IARC or the WHO. Just a summary of what I'll go over. So some prevalence information on NAFLD, and then looking at the global burden of primary liver cancer, as well as some future predictions of the burden of liver cancer. Then looking at some recent trends of liver cancer rates to inform future predictions, as well as looking at the impact of NAFLD on liver cancer burden, and then a potential impact on extrahepatic cancers. So I saw I was first up this afternoon and thought I should probably give a definition, but if any of you are less familiar, non-alcoholic fatty liver disease is a spectrum of conditions in which excess fat builds up in the liver in the absence of heavy alcohol use. And this ranges from non-alcoholic fatty liver, progressing to non-alcoholic steatohepatitis, and this can further progress to cirrhosis and potentially hepatocellular carcinoma. Globally, these are based on the latest meta-analyses, but globally 1 in 3 people have NAFLD, and due to its shared metabolic risk factors, there are some high-risk groups, including people with type 2 diabetes and obesity. So about 6 in 10 people with type 2 diabetes have NAFLD, and this increases to 9 in 10 people with severe obesity. So these are global estimates. And with the global estimate of 1 in 3 people with NAFLD, that translates to 1.7 billion adults worldwide having NAFLD. This varies between areas of the world, as you might expect. And in the latest estimates, the lowest rates of NAFLD were in Southeast Asia and South Asia, with 24 and 29% of the population having NAFLD. And this increases to 38% in North America and Australia, and up to 43% in North Africa and the Middle East. But I think it's also important to point out that within these populations, so within the countries, there's still variation between subgroups of the population. For example, in the US, Mexican Americans have the highest rates of NAFLD and have higher rates compared to white Americans and black Americans. So just wanted to point that out as well, some inequalities within countries. And the global prevalence of NAFLD is increasing and has increased by around a half over the past 30 years. So we can see with the survey data from the 1990s and early 2000s, it was about 25% of the population, and that's increased to 38% in the latest years of survey data that were included in this meta-analysis. And NAFLD is now the most common chronic liver disorder globally. And this increase in NAFLD prevalence has mirrored the increase that we've seen in obesity prevalence in all world regions. For obesity rates among men, these are highest in high-income Western countries, so that's where you see the tallest dark blue bar on the chart. And for women, the highest prevalence of obesity is now in just have to look at the thing. Central Asia, the Middle East, and North Africa, but also in high-income Western countries, as well as Latin America and the Caribbean and Oceania. So again, the highest dark red charts on bars on the chart there. And so we can think about the increase in obesity and how that's affected NAFLD, and trying to link that back to cancer now. Up to 10% of NAFLD cases can progress to hepatocellular carcinoma, which is the most common subtype of primary liver cancer. So I'll talk about the global burden of primary liver cancer now. So we estimated that in 2020, more than 900,000 people were diagnosed with liver cancer globally, which made liver cancer the 6th most common cancer diagnosed across the world. And liver cancer, it actually ranks higher for deaths, among cancer deaths. So more than 830,000 people died from liver cancer in 2020, and liver cancer is the 3rd most common cause of cancer death globally. Liver cancer also, the age at which people die is a bit younger than for other cancer types, and so liver cancer is the 2nd most common cause of premature death and years of life lost from cancer globally. So we can see that here is the orange segment following lung cancer in the pie chart. And if we want to look at the global distribution of liver cancer across the world, we can find the highest rates of liver cancer incidence in East Asian countries and Southeast Asian countries. Also some countries in West Africa and North Africa, and there are a few in Central America and the Caribbean as well. So those are where we're seeing the highest rates of liver cancer incidence, and liver cancer prognosis is very poor. So when we look at liver cancer mortality rates, they're very comparable to incidence. And so we're seeing a similar pattern where liver cancer rates of people dying from liver cancer really reflect those of liver cancer incidence. So as well, we're finding the highest rates in East Asian countries, Southeast Asia, some Western African countries, North Africa, and also Central America and the Caribbean. And as I mentioned, at the global level, liver cancer is the 3rd most common cause of cancer death. But if we want to look by country as well, we can see that 15 countries have liver cancer as the most common cause of cancer death, so even more than lung cancer, which as a cancer epidemiologist, that is a really, really interesting finding and very, very important. And when we look across the top 3 causes of cancer death, it's liver cancer's in the top 3 causes in 46 countries across the world. And again, these are kind of mirroring the where we see the highest rates of liver cancer mortality. So East Asia, Southeast Asia, Western Africa, North Africa, and then some countries in the Caribbean and Central America as well. If we looked at today's liver cancer rates and applied these to the population in 20 years, we would have an increase of more than half of the number of liver cancer cases and deaths occurring per year. So that's an increase of about 500,000 people being diagnosed with or dying from liver cancer in the next 20 years. So this is a really pressing finding, and as I mentioned, this is more of a simplistic prediction using the same rates of liver cancer as we have today. So in our study, we wanted to plot a few scenarios of increasing or decreasing rates to see what could happen over the next 20 years. So on this chart, you see there's lines ranging from a 3% increase per year on rates of liver cancer, and this is from 1, 2 or 3% increase in rates, but then below the black line you also see a 1% decrease or 2% or 3% decrease per year in rates. So this is basically just to plot what could happen to the number of cases or deaths over the next 20 years. But I really want to highlight here that only with a 3% decrease in rates per year would we have an actual decrease in the rates in the number of liver cancer cases or deaths by 2040. So this really highlights that we need action to prevent liver cancer in order to really reduce the burden of liver cancer globally. So as I mentioned, we can use recent trends to inform future predictions. So some of the trends data that we have can go back quite a way, and these are a few countries from those high incidence areas that we have good trends data for. So I've pulled out the data here for the Republic of Korea, Japan, and China, and we have seen a real decrease in liver cancer incidence rates among males in these countries. And this is quite representative of the high-risk countries that I mentioned in the world maps. But then we're also seeing increases in liver cancer incidence rates in previously low incidence countries. So I've plotted these on the same chart here. So for example, in the US, there's been increases, and also Australia and some European countries. It's really great in the US data. We can also split this by ethnicity. So you can see that the rates for black males in the US are much higher than those for white males. But then I also wanted to include some data from the not traditionally Western countries, so including data from Ecuador here, which is the bottom of the chart, and India, and we're seeing increases in liver cancer incidence rates in those countries as well. And seeing as we're in Spain, I also wanted to see what was going on in Spain. So there's a black line on the trend chart there, which is showing a slight increase as well in liver cancer rates among males. So with the increasing liver cancer incidence in some countries, it's hypothesized that this could be due to increasing obesity or NAFLD rates. So I also pulled off the data from the Global Burden of Disease study and plotted the proportion of liver cancer deaths that were due to non-alcoholic steatohepatitis. So at the global level, that's 7% of liver cancer deaths which are due to NASH. But this also varies by country, and you can see that most of those countries or regions where we saw the increasing in in obesity prevalence, they have a proportion of about between 10 and 20% of liver cancer deaths due to NASH. If we look at obesity as a bigger group, then the proportion of liver cancer deaths that were due to high body mass index is much higher. About 12.5% of liver cancer deaths attributable to high BMI. And yeah, most countries here were within the brackets of 10 and 20% of liver cancer deaths due to high BMI. And just moving on, have we underestimated NAFLD's impact on cancer? There's some evidence that NAFLD can increase the risk of cancers other than liver cancer, and particularly cancers of the gastrointestinal tract, or specifically colorectal cancer, as well as breast cancer. And these are two of the most common cancers globally as well. But the studies where this information is coming from did mention that it's uncertain whether this association is a consequence of the shared metabolic risk factors, or whether it's a true independent effect. So to summarize what I've just gone over, 1 in 3 people have NAFLD, and NAFLD is now the most common chronic liver disorder globally. Liver cancer rates are increasing in previously low incidence countries. Oops. I don't know, that's me. Which is possibly due to a rise in obesity and NAFLD prevalence globally. The number of people diagnosed with or dying from liver cancer is predicted to continue to grow unless primary prevention of liver cancer is prioritized. And that is nicely depicted in the cover of the Journal of Hepatology, where we published our study in the December issue last year, which is representing the growing burden of liver cancer that humanity will have to bear, is how they described it, unless primary prevention is prioritized. And finally, we might have underestimated the risk of NAFLD, and there could be a link with other common extrahepatic cancers. So that was my summary, but I'd like to thank my team at IARC and my collaborators, as well as Professor Lazarus for inspiring me to look more into NAFLD and liver cancer research. And I could go back to my title slide, but when I was putting my slides together, we also have this small symbol on the bottom right-hand corner from my organisation, which is meant to symbolise innovation. So I'm handing that over to you for this innovative workshop. Thank you so much.